Good afternoon, everyone. My name is Jaisal Timura, and I'm going to assess the shampoo in bed. So, the shampoo in bed is the washing of the hair with the use of shampoo or bath soap as often as necessary to keep it clean. So, the purpose of the shampoo in bed is that to cleanse the hair and the scalp. Next is to maintain or improve the self-esteem, to treat conditions of the scalp with a topical application of medication,
to remove substances such as blood, body secretions, or electrode jelly. It is used when AB electroencephalogram or other such study is done. To assess the shampoo in bed, we will examine the hair or examine the hair, note its distribution, cleanliness, texture, and any indication of the parasitic infection such as the nits of heads, lice on the hair shaft. Next, we will inspect the scalp for laceration, dry scaly patches, scratches, lesions, and swollen areas, and then observe the client for signs of any itchiness of the scalp such as scratching the head.
And then the fourth one is that note signs of dandruff on the shoulder and the back clothing. Determine the client if it is receiving toxic chemotherapy or radiation treatment that may cause loss of hair.
Read the client's medical record to determine if the client has any pathology such as hypothyroidism or is receiving long-term steroid therapy that may alter the texture and distribution of hair.
Next is that identify if there are any sensory, cognitive, endurance, mobility, or motivational deficits that interfere with the client's ability to perform hygiene practices. Next is ask the client to describe the usual routine for shampooing, including the frequency and types of hair products certainly used. Number 9, inquire if the client experiences any itching, burning, or tenderness of the scalp. And lastly, note the client's history of hair or scalp problems and related treatments. Before proceeding to the next procedure, we will complete our equipment first. So the equipment needed are the tray containing the hair shampoo, 3 bath towels, pitcher with hot water, and then the comb or the hair brush, 2 dry cotton balls, 2 pails, which is the pail containing 2/3 full of clean water, and the empty pail. Next is the shampoo through waterproof pad, and lastly the paper linings.
So these are the step-by-step process of the procedure. So first, assess the need for shampoo and for contradiction in performing the hair wash. These prevent injury to the client. Next, explain the procedure to the client. An explanation facilitates understandings and cooperation.
Hello sir, good morning. I am Jaisal and your student nurse for today. And I am here because I'm going to assess to shampoo your head. Can you state your name please?
Joko Artelieda.
And your birthday?
April 20, 2016.
Okay, thank you sir. Okay sir, this shampoo in bed will help you to make your hair healthy and your hair will become more shiny. So, I'll be back and then I'll get my equipments first before we proceed to the shampoo in bed. Is it okay, sir? Okay, thank you.
Do not forget to wash your hands because hand washing reduces the transient microorganism, thus deters the spread to client and self. Assemble and bring the equipment to the client's bedside. Organization is a form of appropriate time management and prevents fatigue and frustration of the client. Close the curtain or windows and door to prevent sailing and to provide client's privacy.
So now let's position our patient near us and then reposition the pillow under the client's shoulder.
A supine facilitates drainage away from the face, eyes, and head. The cotton balls prevent entrance of water inside the ears. After that, lay the waterproof pad under the client's head covering the pillow, and then lay towel on the waterproof pad, and then replace the top sheet with a bath blanket. Place a rolled bath towel under the client's head. Using a thorough provides a method for collecting and draining the water away from the client and the bed. Place a rolled bath towel under the client's nape with the ends of the towel placed on the client's chest part. Layered material absorbs water and prevents the client from feeling wet and chilled. It also avoids saturating the bed linen. After that, comb or brush the client's hair. Removing tangles before washing will prevent breaking strands of hair. Place a damp washcloth over the client's eye. Sir, ako nang ibutang kini sa imong mata ha. Place a dry cotton balls in both external ears. Dry cotton balls will keep the water from collecting in the air canal, and the damp washcloth will remain in place and protect the eye from possible irritation. After that, to wet his hair, we will mix the hot water and the cold water to get the perfect temperature of a warm water. So this is the hot water. I'll be putting a cold water. And I'll be using my elbow to ensure that the water is already a warm water. Now, wet the hair thoroughly with warm water and then apply shampoo according to client's preference. Sir, basaon na ko imong ulo ha. Wet hair dilutes the shampoo and help to form suds. Work the shampoo into a lather while massaging the scalp with the pads of the fingerprints. Lathering helps distribute the shampoo throughout the entire hair for uniform cleansing. Massage of the scalp stimulates blood circulation. Rinse the hair with clean water. Rinsing prevents leaving shampoo in the air, which gives hair a dull appearance. If left on the scalp, shampoo could cause irritation in some people. Remove shampoo through. Wrap the client's head with towel from the client's neck. Towel absorbs water. Now remove the damp washcloth from the eyes and CBs from the external ears. Remove the waterproof pad and then reposition the pillow under the head. Change the towel wrap around the head with the dry towel from the pillow and then fluff the hair with towel and comb. Fluffing thoroughly dries the hair. Remove the equipment used from shampooing. Discarding the water and the equipment will prevent accidental spilling. So after everything, wash the equipment used and return to their proper places. And then wash your hands because hand washing reduces the transient microorganism, thus deters the spread to client and self. Document care provided, the client's ability to participate and his or her response. Careful recording is important for planning and individualizing the client's care.